All right, everyone. Hello, my name is Kylie Hall. I am the project coordinator in the NDSU Center for Immunization Research and Education, and today it is my absolute pleasure to introduce Dr. Caitlin Jetelina. She is an epidemiologist, a mixed methods expert, and a scientific communications specialist. In 2014, she received her Master of Public Health in Epidemiology, and in 2016 received her PhD in Epidemiology and Biostatistics at UT Health. Currently, she's an assistant professor in the Department of Epidemiology at the University of Texas Health Science Center School of Public Health, where her Violence Epidemiology Research Lab resides and where she teaches graduate and medical students. She has an adjunct faculty position at the University of Texas Southwestern Medical Center. And in addition to all of those roles, she is the founder and sole author of Your Local Epidemiologist, which is a viral blog that translates scientific research and events like the COVID-19 pandemic to the layman. I will add that those of us who work in CERI and those of us who helped plan the conference, we're all big fans of the Your Local Epidemiologist Facebook page, and we're so excited that she was able to speak at our conference today. Dr. Jetelina, you can begin.
Great, thanks for having me. I'm really excited to be here and talk about my lived experience during this pandemic, really from an epidemiology, scientific communication perspective, focusing on misinformation. I am just going to assume that you guys can see my slides and I will go forward. So who am I? I am an epidemiologist. I have been a faculty member for about 4 years now. And so, before this pandemic, I was really just going about my business as an early career investigator, building my research lab, teaching. And, there's many different types of epidemiologists, as I'm sure you guys know. So my research lab isn't focused on clinical scientists, right? I'm also not a wet lab scientist. I'm not necessarily in the field a lot, but what I am is a data scientist. I'm a researcher. And while I love to think this is what my job looks like on the bottom right, so high tech and cutting edge, it is as exciting as it looks though. But this is what it looks like more in reality. My lab is a combination of my computer, my brain, statistical software. That's my office on the bottom with my daughter sitting in my chair. But more importantly, I have a multidisciplinary team, which you can see at that top right. I'm working a lot through, my lab focuses actually on violence epidemiology. So March 2020 hits, right? 15 months ago. And this is really where my story starts for this presentation. And I really think a lot of ours in the United States started here, because before this, I was just bebopping on my way, continuing my work and watching COVID spread internationally. And then the US gets hit hard. And so us epidemiologists were really thrown into an all hands on deck response. Even if you're an epidemiologist not focusing on infectious diseases like myself, we all have the training to help. And so we all jumped in. And to me, this is where we started to see the birth, at least in the United States, of two pandemics, a pandemic of disease, as well as a pandemic of misinformation. And I was at the forefront of both of those. But this talk is really going to focus on this second one, is the pandemic of misinformation, really due to the lack of effective and timely scientific communication. And so we responded, right? March 2020 hit and we responded. We were, in respond, I like to put in quotation marks because it feels like the word respond sounds coordinated. And to my perspective, it was all but coordinated. I thought a better word to use is scramble. We were scrambling for data. There was no systematic thing in place for the United States. Johns Hopkins was the closest thing in March 2020 that we had. So we had to go find the data from hospitals, from WHO, from volunteers, from anecdotal data. in order to really respond, surveillance, trace, and test. We're also scrambling to see what makes sense on a policy level, right? We were throwing spaghetti at the wall to see what stuck. Or like I like to say, driving the ship as we are building it. We needed to know what was working and what was working quickly. Also displaying the data. As epidemiologists in March 2020, we're really working with biostatisticians and data informatics teams to figure out how to display the data, right? And so this is why I think we have 1,000,001 dashboards now, is because we didn't have this before the pandemic started. And then most importantly, what I think is we needed to start communicating to the public of what was going on, bringing them along with the story, bring them along with what was happening. And so I kind of stumbled upon this. My dean at my school asked me, she knew I was doing analysis at night on Excel, just with anything to understand what was going on in Italy, what that meant for the United States. And so she asked me to write emails to our staff and our faculty and our students about what was going on. I called them my daily data-driven updates. This email was from March 18th, 2020, and really just walking through what data we were seeing. And I assigned these always as your local epidemiologist. Now, after a few of these emails, a student walked up to me and was like, hey, can you please put this on Facebook or social media so I can easily disseminate it? I don't have to retype it all. I don't have to copy and paste it. And so that's what I did. I started a Facebook page called Your Local Epidemiologist. It was my mission to close the communication loop, right? Translate public health science for everyday use. Provide data-driven, evidence-based strategies so people can make their own decisions and actually understand what was going on in real time. And so at first, I was super excited. My mom and my sister were following me. I had some students following me. Some of my local community, my little town was following. And as time went on, I discovered a really big gap. And this was really discovered haphazardly. And I actually discovered two gaps. First was the lack of accurate scientific translation to the community. Community members were, and still continue to be this day, required to drink from a fire hose of information. And without scientific translation, they've been left to biased reports. Which has caused confusion and anxiety, and quite frankly, groups to stop listening to public health officials altogether. Concurrently, I discovered there's really no platform in which we can share science with the community in a direct manner, right? Well, scientists have forums to share research with each other, scientist to scientist, like, scientific journals, ResearchGate. There's no platform to share scientific findings with the community. Scientists are completely dependent on mass media. The problem with this is it introduces intrinsic bias and sometimes incorrect summaries. So unfortunately, this causes science to feed echo chambers instead of infiltrate them. And so by identifying these gaps, my following started to grow, and it grew and it grew and it grew. And what started out as a couple hundred people, I just pulled this data yesterday from Facebook, I have reached about 70 million people with my data-driven posts, which is mind-boggling to me to this day. It's absolutely crazy. Now, throughout the waves of scientific communication, I'll say, this shifted throughout the pandemic of what I was focusing on, right? So in the beginning, I mentioned I was focusing a lot on data-driven updates. What was the raw data and what were we seeing? Are we going to see a next epicenter? What is case fatality rate? We didn't even know that in the beginning. So then this summer, the next wave kind of scientific communication started, where I started moving away from data-driven updates into more scientific literature updates. And this is really for a couple of reasons. One, I'm a one-woman show. I couldn't keep up with the analysis and dissemination. Also, during the summer of 2020, scientific literature finally started coming out. It was lagged because it was, it takes time to get data and develop teams, but and go through the peer review process, but it was starting to really come out. And so I was happy that I could highlight other scientists' work. We were all working as a team. Then in the fall, I noticed the theme of my scientific communication moved to behaviors, right? How does your behavior impact others? And this is really because this is where pandemic fatigue really started to come into play. And so, for example, this was one post I did in September of 2024 is when there's this Maine wedding that happened. And I created a little infographic saying, hey, there was a super spreader event at a wedding. 127 people went. It ended up spreading to over 300 miles away because of this event. And 8 people died that didn't even attend the wedding in the first place. So your actions impact the response. Then the scientific communication really, as you can guess, went to vaccines and variants, right? Not only what happened in clinical trials and educating the FDA process, but also what's happening in the real world in terms of side effects, and keeping track of the different vaccines and giving people options of what data they want to follow. So this content shifted throughout the pandemic, just like this disease shifted, just like our behavior shifted over time. But one thing that was consistent, there was one theme, and I bet you can guess it, it was misinformation. Throughout the entire pandemic, throughout all of my posts, people have been also getting a lot of misinformation. And there's many definitions of this, but for me, I'm going to use this presentation, I'm going to use a definition that it's inaccurate information shared unconsciously, right, by believing the information is true, but it's also inaccurate information that's shared consciously as well. And so why is this happening, right? Misinformation is not new. It's been, around since the golden ages, but during the pandemic, it spread like wildfire. And why, right? So, it's this thing called an infodemic. It is an overabundance of information, some accurate, some not, and it makes it hard for people to find trustworthy sources and reliable guidance on when they need it, right? It was an information overload, which can and does cause anxiety. Even if the information is true, it causes anxiety. And this is why the World Health Organization deemed it as a top global health threat. And they actually deemed it a top global health threat even before it reached the United States. So when addressing the security conference in Munich on February 15th, 2020, the WHO director, Tedros, said, we're not just fighting an epidemic, we're fighting an infodemic. Fake news spreads faster and more easier than this virus, and it's just as dangerous. So why is it dangerous, right? Well, for one, infodemic turns to misinformation. This is particularly true in the United States. In fact, a scientist published an article showing how the infodemic impacted mortality, public health interventions, and treatment. They examined how rumors, stigma, and conspiracy theories circulated social media between the early stages, so like December to April 2020. And what did they find? You won't be surprised, but misinformation was present in 87 countries in 25 different languages. Interestingly, countries with the highest rate of misinformation were, in this order, India, United States, and China. So misinformation is rampant in the United States, especially when we compare to other countries. So why is this a problem? It leads to the suboptimal control of the pandemic. Misinformation influences behaviors. For example, take this rumor, that was started as a text message and migrated to social media. I screenshotted the meme, but it basically said, within 48 to 72 hours, the president is going to enforce a quarantine of the nation. So stock up, right? And make sure you have everything you need for the next couple of weeks. And the rumors about this national lockdown in the United States fueled panic buying. And, groceries, paper products, toilet paper. The problem with this, right, is it disrupted the supply chain and increased or exacerbated the food insecurity among individuals with low social economic status. They didn't have access to food. And this was a huge public health problem in the beginning of the pandemic. Another example, CNN, right, anticipated a rumor about a lockdown in the northern region of Italy. And they published the news hours before an official communication from the Italian prime minister. The problem with this is it caused panic. People overcrowded trains and airports really to escape to the southern regions before the lockdown was put into place. The problem with disrupting this government initiative was that it went against it, right? It potentially increased the contagion. And so, what happened with the news leak is it caused more people to try and escape, causing the opposite effect of what this decree was trying to achieve. And so there was chaos in Italy. Misinformation can influence behavior, and honestly, this behavior can sometimes hurt people. For example, in Nigeria, improper health communication, like a certain tweet from a certain president, had health officials finding several cases of overdoses of chloroquine. People ended up killing themselves because of misinformation, of using a drug to treat malaria. And so it can be very dangerous at the same time. Okay. So how do we combat misinformation, right? So first of all, you need to know the landscape. The landscape is, information ecosystem is changing. The information ecosystem is very different than it used to be. People no longer get their information from newspapers. And actually, in fact, 30% of Americans don't trust the news overall. We have social media, and it's a huge part of how people get their news and really their greatest source of health information worldwide. Over 70% of adults in the United States use internet for searching for health-related information. And, the diffusion of social media has opened up an exciting field, right? It is capable, at least potentially, increasing the degree of clarity and democracy and sharing scientific data. But in the same way, it's also dramatically increased the degree of credibility of personal opinions, right? Beliefs and considerations. But nonetheless, you need to know the difference with social media and the different avenues, right? So LinkedIn has a very different audience, right? Affluent professionals than, for example, Facebook, who has, 2.3 billion people, those between the age of 25 and 54, usually for socializing. And it's really the largest audience on social media right now. You also have Twitter, which is a lot more quick. You share opinions, you share news just by retweeting. And then you have Instagram, where a lot of people, especially younger people, like 65% of 18 to 35-year-olds use Instagram for their news. It has visual appeal, and they really build influence this way. Another part of the landscape is that misinformation goes further, faster, deeper, and more broadly than the truth. A study by MIT found that false news reached more people than the truth, right? It reached more people. It was retweeted by more people. It spread through more peer-to-peer interactions. It was 6 times faster at spreading than the truth was. It was retweeted by more unique users, and it was diffused more broadly. So, these findings really shed a new light that the fundamental aspects of our online communication ecosystem is changing, and we need to pay attention to this. Another part of knowing the landscape is recognizing that our relationship to information is emotional. Language that plays on fear gets high level of engagement. So, misinformation that spreads the farthest is information that plays on emotion, on fear, on distrust, information that elicits strong emotional reactions. And we see this in all topics, but COVID right now, right, because it's ripe, it's easy to play on emotions, it's a complex topic, so it's difficult to communicate. So what NPR did was they looked at what type of information gets the most clicks. And what they found was they analyzed all types of news stories. And the stories that got the most attention this year were stories about death following vaccine. The vaccine story with the most engagement from 2021, wasn't about rollout, wasn't about the FDA meetings, wasn't about clinical trial research. It was a news story in South Florida about a doctor who died a few weeks after receiving the vaccine. And the interesting thing that NPR found was that this story ranked high engagement, not just on the first day it came out, but every subsequent day that it came out. To this day, it is one of the highest read articles on the internet. Language plays on fear, and it gets high engagement, and we need to recognize this. Another thing we need to recognize is that misinformation circulates in places that feel safe, right? It circulates in my local Moms of Coppell group, right? It circulates in community groups as well. And we need to recognize where it's circulating so we can also penetrate that misinformation as well. So once you know the landscape, you need to listen. You need to recognize what's spreading. And the only way to do that is listen. And listen is different than hearing, right? Hearing is much easier because it's involuntary. There's no conscious effort required. But we need to do the opposite and listen. And we need to listen because there are legitimate concerns that exist. We've failed in the past, especially with certain groups. Take the vaccine campaign to find Osama bin Laden in Pakistan. Yes, we were successful in finding him because of this, but it severely hurt the trust of health professionals and vaccines in Pakistan. When we take this to the local level in the United States, right, there have been marginalized groups in the past, like Blacks and African Americans. So we can and need to address concerns, and really from a place of empathy, understanding that there are legitimate concerns, that this is a confusing time for people. Don't only listen to questions, but look for the questions. Open a tip line, right? Be proactive. On social media, people are asking thousands of questions in the comment sections on websites, in the comment section on Facebook, in private messages that I receive. So much that so many people had so many questions in private messages to me that I started a database to find what theme to address, what was popping up that day that I can help clarify. The other thing is, communication is a two-way street. As epidemiologists and public health officials, we've been doing a lot of telling, right? Telling, and we needed to because this was a public health emergency. But we really also need to open up for bi-directional relationship with the community. And this is hard to do, right? Especially right now, we're trying to fight a pandemic, we're trying to save lives. We don't have time to stop and listen, but we need to make that time to have that bi-directional relationship, to listen to those concerns. Also, again, know where people are talking. They're talking on social media, they're talking in the comment section of YouTube, they're talking in the comment section of news articles. Then, so once you have this background, right, you are listening, the third way to fight misinformation is you have to find the kernel of truth. We all have to recognize, claims are folded within complex scientific terms. And this is actually the most dangerous form of misinformation from my perspective, is because within this complex technical jargon, it's impossible for non-experts to decode the science. They just can't do it. And so what they take is, hey, this sounds right. It sounds technical. It sounds right. I should be worried. So I wanted to give a few examples of how to find the kernel of truth. And, the first one is Health Impact News posted this on May 5th, and it spread like wildfire. That the CDC, on CDC's website, there's 4,100 Americans dead following the vaccine. The kernel of truth is, it was. There is a CDC website called VAERS that does say that. It is true. The problem is when they come to an inaccurate conclusion because they're missing really important context. Another one, right? So another misinformation about infertility claims with the vaccine. So last December, a German epidemiologist said the COVID vaccines might make women's bodies reject a protein that's connected to the placenta, therefore making women infertile. What's the kernel of truth? It's that, yeah, our placentas do have this receptor, right? The spike proteins on the placenta and on the virus are from the same family. They work the same way. However, they aren't similar enough. They don't have enough amino acid sequences to cause confusion to the immune system. So in other words, the immune system cannot and will not mistake the placenta for the virus. The problem is this context is lost, and people once again come to an inaccurate conclusion that the vaccines cause infertility. And last example, and maybe one of the ones that I see the most, is that vaccines will change our DNA. On May 26th, there was this Facebook post, which included quotes, but there was no cites of sources, basically claiming that Moderna's chief medical officer said that mRNA vaccines alter DNA. And, other posts on Instagram and Facebook made the same claim that, bombshell, Moderna chief medical officer admits mRNA alters DNA. So where's the kernel of truth in that? Sometimes there isn't a scientific kernel of truth. The kernel of truth is that it's behavioral based. We have a pretty scientific illiterate base in the United States. mRNA sounds and looks like DNA. And that's the truth. And we need to educate the differences of this and explain why this isn't a concern so people don't come to inaccurate conclusions. So once you find that kernel of truth, you start combating, right? And how do you start combating? You lead with the truth, right? Walk them through the process, bring them along for the ride on this story. Start off saying, yeah, VAERS states that 4,000 people have died from the vaccine, or yeah, mRNA sounds like DNA. What's even harder and probably more important is say if you don't know something, right? This is really hard for scientists or clinicians or public health officials to do because we're looked at as the specialists. We should know everything. However, we just don't know everything, and that is the reality. So own up to it, especially in the beginning. After you lead with the truth, continue by providing an alternative explanation, right? Provide the why, because if you don't, that why will provide a vacuum with whatever information they can find online. And that explanation can be really simple. So take this example of VAERS, right? 4,100 Americans have died because of vaccine. There's an alternative explanation of this, right? Is that there's this thing called passive surveillance. VAERS runs on an honor system. This honor system is dependent on people providing accurate data, which sometimes people knowingly or unknowingly do. Which leads to incomplete, inaccurate, unverifiable data, which cannot imply causality. So walk people through what VAERS is and how to be critical of it. These two sentences at the bottom of the slide were taken, copy and pasted from CDC's website. It says it all over there. No, we don't know the long-term outcomes of the mRNA, right? There's no long-term data on this, and don't state that there is. We have about 8 months after phase 3 clinical trials started. But what we do know, right, the alternative explanation is we know a whole lot about the vaccine ingredients and we know a whole lot about the human body. So much that we're confident that this won't cause infertility, right? Vaccine ingredients are cleared within the body quickly. mRNA degrades within 72 hours. The fat bubbles that carry mRNA degrades within 4 days. It's not lingering in your system. We also know that the history of vaccines, side effects have only popped up within 6 to 8 weeks, period. And so we're not expecting long-term outcomes either, but we are paying very close attention to safety signals. We have the processes in place. Another example, right? mRNA will change our DNA. Alternative explanation, walk them through why this won't happen, right? mRNA doesn't have a secret door code. They don't have this tool called reverse transcriptase. So the mRNA can't even be converted to DNA even if it wanted to. And then even if it was, the mRNA cannot insert itself into the DNA. The mRNA would need a tool called integrase to do this, and the vaccine just doesn't have it. So provide them the science in the best way, in the most layman way you can, to explain why this isn't a concern. And then sometimes really there's no kernel of truth, right? Why? So Christian Elliott is a figure that has been spreading a lot of misinformation online that I have been debunking for months now. But, sometimes the alternative explanation is, why would an influencer lead the public astray or flat out lie? And the explanation is to turn a profit, right? This is pretty simple and not necessarily science-based. People don't realize the anti-vax industry is worth up to $1.1 billion to big tech, and they have revenues of at least $36 million. A lot of people don't realize 4 families control 70% of the anti-vax content or conversation. So this is also an alternative explanation you can give. So lead with the truth, offer alternative explanation, be thoughtful in your language. What you say matters. How we communicate correct information matters, especially to people who are hesitant or believe in conspiracy theories. Do not be condescending, alienating. That's something that's not empathetic. Don't say insane or dumb or whatever. I like First Draft put these headlines together, which I really appreciated. And what they pointed out with these headlines is, all you do when you use this language is you are challenging their worldview, and people will double down because, the worldview is linked to their identity. It's their people and the tribes they're a part of. So we need to set new foundations to build trust. And to build trust, you can't use this language, however frustrated you may be. So combating misinformation, know the landscape, where it's spreading, what it's driven by, recognize what's spreading, right? What are the questions? Seek those questions, find the kernel of truth, and start countering, right? Lead with the truth, offer an alternative explanation, and pay attention to language. The last couple of slides I wanted to do before opening up to questions is just give an overview of my lessons learned in the field. The number one lesson is that fighting misinformation is absolutely exhausting. It's a lot of work, and it's not new, right? It takes me hours to write one scientific post, and it'll take approximately 2 seconds to retweet misinformation. And I love this Winston Churchill quote, which says, "A lie can go around the world before the truth gets its pants on." And this has been the story of my life the past 15 months. I see it's a losing battle, right? But it's one that's important to continue to fight. And a few of us cannot do it alone. So that brings me to my next point, in that you recognize the role that you play, right? What's significant about this is that we all have a role to play, whether you're posting something, whether you're a public health official, whether you're a clinician talking to a patient, all the information we put out there plays in some way, plays into this ecosystem of new information. You play a role talking to family, talking to friends, reading the news, talking to patients, getting a popsicle in line, someone may be overhearing you. So, a lot of people don't listen to the ivory towers. This has to be a grassroots effort, and we all play a role. So please recognize your role. The other lesson that I've learned is that we need to be proactive instead of reactive, right? We need to anticipate the concerns. For example, we had 9 months to prepare that vaccines were coming down the pipeline. But given that warning signal that we had this was coming, we continue to play a reactive game. We did not prepare, and so now we're continuing to play catch up. This was, and being proactive can be anything. It can be a little piece of paper that you hand out to patients. This is one that I created for my followers that a lot of physicians have asked for the PDF to start printing out and just handing which is anticipating parents' concerns about the COVID adolescent vaccine. And it anticipates these concerns, right? That the vaccine was not rushed, that your adolescents will probably experience side effects, that there is a need, right? Why do adolescents need the vaccine? That mRNA doesn't change DNA, that long-term side effects like infertility are unlikely, and that previously recovered adolescents still need the vaccine. Anticipate these questions and provide them with the why, grounded in science, in layman's terms. The other thing that the lesson that I have learned is to be inclusive. Make it your goal to break echo chambers. There is this, Johnson and colleagues did this social network analysis study that was published last month, actually. And they did a series of computer simulations to look at how and where, both with accurate and inaccurate information, spreads online. So the blue dots are pro-vaccination pages, which there are 124 in their simulations. And the anti-vax pages are in the red, which were 317 pages. And the green dots were the undecided. And so I wanted you to recognize 3 things from this figure. You can see that 1, there's an echo chamber, clear separation between blue and red. 2 is anti-vaccination pages actually have fewer followers. If you look at the box in D, they have 4.2 million followers, while pro-vaccination pages have 6.9 million followers. The difference is there's more numerous pages of anti-vaxxers than pro-vaxxers, right? 317 versus 124. And third, I want you to notice, which I think this is the most important, is that anti-vaxxers are more often linked to in discussions on other Facebook pages, like parent associations at schools or whatever, whose stance is vaccination is undecided. So, for example, in this picture, you can notice that the red dots are a whole lot closer to the green than the blue is. So what this means is pages that explain the benefits and the scientific case for vaccination are largely disconnected from the main battlefield of public sentiment, right? This work really shows that pro-vaccine communities are just talking to each other. They're not reaching out and they're not being responsive to narratives that are out there among the undecided. And so be inclusive, try and break those echo chambers, try and get to those green dots more. That has been my mantra for the past 15 months. The other thing to recognize is, social media companies, I will give them credit, they are trying, right? They, for example, they give these false information, fact checker, pop-ups when something on misinformation on Facebook arises. They also have been doing a lot of grassroots support. For example, Facebook reached out to me and gave me ad credits. So my scientific information infiltrates even more people on a broader scale. the problem is social media companies are also struggling. They're struggling to control the online health misinformation. And one way they're struggling is that, one, they're not really making it easy for us that are fighting it online. I was hacked by anti-vaxxers in February. My page was I couldn't reach my page. They started posting stuff. I had no contact to Facebook, even though it was reported. It took about 10 days to get my page back. But I will tell you, the only reason I got my page back is because my girlfriend works at Facebook headquarters and she knew how to escalate it. If I didn't have that contact, I would still not have access to the page. And that's dangerous. That's dangerous because what these people started doing on my page is that they started campaigns like, hey, upload your vaccination card, because I want to give $1,000 to a raffle. And so people thought it was still me talking, right? I've built this trust, I've built this foundation, but about 200 people uploaded their vaccination cards, and who knows what happened to those. I'm sure they were, copied and sold for others. The other problem is, and social media and how they're struggling, is that their logarithm on their back end is automatic. And so they block my posts when I'm trying to fight misinformation. And this can be due to the language I use, like saying the Yan report or lab theory, leak theory, like this post was blocked. But this can also be due to, this actually automatically happens when enough people report the post. So say, anti-vaxxers find it a threat. And so they disseminate, say, hey, report this post, and it gets blocked on Facebook. And so, tech is having a really hard time winning this battle. So I'll leave you with this kind of quote, right? I love that it said, misinformation is not like a plumbing problem you fix. It's a social condition. It's like crime. And you must all constantly monitor and adjust to it. And I completely agree with this. The major challenge in scientific communication is the new shape of truth, right? Truth is no longer dictated by authorities, but it's networked by peers. So for every fact, there's a counterfact. And all of those counterfacts look identical online to actual real facts. And this is confusing a lot of people. And we all play a role in fighting this. And so I wanted to end you with this picture, right? The pandemic has really been a dark storm. It's cost a lot of lives in the US and across the globe. But I also don't think it's all doom and gloom with this misinformation. I think there's a lot of lessons we can learn during this pandemic. We need a lot of self-reflection, but we can learn from it, and it'll help us with our next, right? And help us with other health crises we're currently fighting, or even in the future. So we just really all need to do our part. And so I'll end it there. And I really wanted to open it up for questions. I think you can write them in the chat, and I'll try and answer them.
Wonderful. Thank you, Dr. Jetelina. I have a couple of questions to get us started. So one of the first ones is, how do you respond to maybe vaccine trolls or people on your page who are posting comments of misinformation? Do you engage with them, or do you let them go? What do you do?
That's a really good question. What you have to recognize, and maybe I should have added this in the landscape, is that vaccine hesitancy is very different than anti-vaccine, right? We need to separate those two, and we need to first identify, right? You think they are really just trolling, or they have a legitimate concern. And sometimes you don't even know. Sometimes you have to probe a little, be like, hey, this is a great question. I wrote a previous post on this, or you can find a great article here from the Atlantic on it. And then if they continue to fight you, it's very easy to know what their next comment is, to see if they're actually hesitant and they're appreciative of more information, or they're just looking for a fight. If they're looking for a fight, quite frankly, at least on my page, I block them. It's for accurate information, for healthy conversation. And if they're hesitant, I continue that. And a lot of people recognize that and also join in on the conversation. And so again, it comes a two-way street, especially if you can parse out the difference between hesitancy and just anti-vax.
Yeah, absolutely. Another question, why or how did you choose Facebook as your main platform for sharing information?
That's a good question. So at first I started with Facebook and Instagram. I thought, especially anticipating vaccines, that Instagram hits a lot of young people. And so I really wanted to enter that. The problem is you can't just copy and paste a Facebook post to Instagram because the word limits are different. It gets super annoying. They crop the pictures when you put on Instagram. I quite frankly just didn't have the time to be doing that sort of stuff. So I had to decide real quickly what was kind of my primary. And I originally I chose Facebook. After the hacking, I recognized that Facebook we rent space from social media. I all of a sudden lost all of my information. I didn't own it anymore. Some random person that hacked me owned it. And so this really made me self-reflective. Do I really want primary on social media? And so I actually went to Substack, which is a newsletter that, I own the information. It's a little more difficult to hack, et cetera, et cetera. And so what I do now is I write on Substack. I send it out to the 50,000 email addresses, but then I also copy and paste it to Facebook because I recognize that infiltrating social media is important too.
Yeah, that's really interesting. We've had a couple of people who have commented that they're loving your adolescent handout and they are wondering how they can get their hands on it for providers and for parents.
Yeah, so I'm sure we can share it through the conference. If not, you can go to my Substack, your local epidemiologist, and if you subscribe and send me an email, I'm happy to send the PDF to whoever and wherever to disseminate.
Okay, wonderful. So for those of you who are wondering, we'll make sure we send that out with either the conference handouts or something like that. One of the staples, I think, on your Facebook page and through your newsletter is your big vaccine table that talks about all the variants and how well the vaccines work against the variants. And so somebody is wondering if you could talk a little bit about the Delta variant, how the vaccines seem to be performing. What does immunity look like for those who've had natural infection? And will the vaccine work against the new variant that's of concern?
Yeah, and I will say, we're as epidemiologists, we're looking at this very closely. We're actually watching what's happening in the UK right now very closely. So the good news is the vaccines are working. Pfizer, Moderna, and J&J should be working, especially, and this is important, once you're fully vaccinated. So it looks like a lot of people are getting the Delta variant who just have one shot in the UK. And that's because they implemented a different policy than we did in the United States. They're actually not waiting the 4 weeks, they're waiting 12 weeks in between doses to get more vaccines in arms. And so it seems that this is hurting them. Because of that, right, it's spreading more quickly among younger populations, just because younger populations aren't as vaccinated as the older populations. The good news with it spreading, I guess, if there is good news around younger populations, is the death rates not increasing. Hospitalizations are increasing. The prevalence of long COVID, I'm sure, is increasing among younger kids, but the death isn't. And so we're kind of entering a new phase, and we think that new phase is coming to the United States. I think the last estimate was that the Delta variant's about 10% of variants in the United States. And so it's doubling every 8 days. And so we think it's coming, especially here in the South where I am in Texas.
Yeah, I think you're probably right about that. I kind of have two questions here that I've received. wondering how we can get to children who are in school, so middle school, high school, how we can teach them to be more more scientific in their thinking, better critical thinkers. What do you think is required of that to not only look at information, but evaluate, is it credible? How can I find out if, if there's some bias in there? What kinds of things could we do in schools and while we're educating students to think more critically about misinformation?
Wow, that's a great question. So I have a couple ideas. I do want, before I go into these ideas, I want to say, we've hit a wall for vaccines, and they're slowing down, deceleration. And we can learn from others in the past. So, for example, with the seatbelts, or also with smoking, the way we hit and got a wave threshold with those other two public health issues was we had younger kids convince their parents that they needed to wear a seatbelt or they needed to stop smoking because it was bad for them. So I really think that this next phase is going to be us. We need to focus on young kids educating their parents. Now you bring up a great point, is that how do you do that, right? So we've never really taught our kids how to critically think in, middle school and even elementary school. It's important. And so, going forward, yeah, we need to continue science classes. I think that we need to make science fun again, a lot more accessible. I saw this quote saying, if you think science is boring, you had a bad teacher. Because it's super exciting. It's really quite incredible to be a part of this. The other thing is that we need to start teaching the layman, kids and even adults, how do you parse out misinformation? And there's lots of tools and, tests you can take to see how good of a misinformation person you are. And then also how to read scientific journal articles, at least the abstract. And what do you need parsed out of it? So really, I think, health departments, I think academic universities can partner with libraries, right? Just little city libraries, or even librarians from elementary schools or middle schools to really focus on these topics for brown bag events.
Yeah, those are really, really neat ideas. And we just had another question in the chat about increasing health and scientific literacy among youth in our country. I think it's a really big need right now. Probably multiple approaches will help increase that literacy. Those are some really, really good ideas. I'm wondering from a practical standpoint. So for those on the call, I think we have a lot of probably healthcare providers, whether it be physicians, nurses, pharmacists, local public health, who don't have time to take an hour to write a post, right? What would be just some really quick tips for them for responding to family and friends on social media who do share myths? What would be just some quick tips that you have for them if they don't have a ton of time?
Yeah, have empathy. Try and understand where they're coming from, listen to them, and then provide them with alternative facts. It may not be you, maybe it's my newsletter, maybe it's NPR. Send them to a trusted source so they can fill that why with evidence-based information, not misinformation. And that can be done fairly quickly. It may take you a minute or two to Google where you can find that information, but it's out there. We just need to disseminate it more widely.
Yeah, absolutely. Another question that I have for you, Dr. Jetelina, is it sounds like before COVID, you weren't working a bunch in the infectious diseases or vaccinology field. Not that your training didn't provide you with that information, but how did you do, your crash courses in vaccines and things like that? What did that look like for you, and how does that continue to evolve going forward?
That's a good question. So, as an epidemiologist, I was trained in that. It's Epi 101 is basically infectious diseases, and we all get a couple courses on that. I also worked at WHO in the division of HIV and AIDS in Geneva. And so I actually am originally an infectious disease epidemiologist, I use that base knowledge to apply it to violence epidemiology. So why do mass shootings happen, et cetera, child abuse, that kind of stuff. And so we use the same theories. And so it was a little easier for me to just jump into it. I will say though, the content that I provide, I lean on, I don't have all the answers. So what I do is I lean on a lot of other professionals and colleagues. I have a go-to immunologist. I'm like, can you just read this and make sure this is right? Or, I have a go-to virologist in Houston that, we text real quick, and they're amazing because I draft out it and I get second eyes on it from an expert. I'm not going to pretend that I know everything. That's certainly not true, but having kind of a multidisciplinary approach is amazing. And I have to give credit to those people. And I do at the end of posts because they're brilliant too. I just happen to have some sort of platform to get it out.
Yeah, absolutely. Having that team is really, really important. All right, so I have one more question for you. Where do you go to get the latest information on COVID vaccines? What are your go-to sources of information?
So there's a couple Twitter followers that I follow, especially with these variants. I will say, and I'm really sad that yesterday, but there's an amazing group at the University of Washington that did literature reviews every single day for the past 14 months. That helped. They basically did a literature review every day and told you what the newest science was that day. So like 10, 15 articles, and gave bullets. And I will say they were a lifesaver for me for trying to comb through what the science and the story said. The other thing is, I have a group of other, nerdy girls, we call it a nerdy girl neighborhood, on Slack. And we share all types of news articles from The Atlantic, from NPR. We share what information is circulating on all the social media platforms. And so really I've kind of built a infrastructure that helps me weed through all of them, I will say. But there's a few trusted sources out there that I continue to watch.
Yeah. So you're not combing through everything yourselves. You're relying on your team, and that's wonderful. It takes a group effort. There's so much information coming out every single day, whether it be about the disease or the vaccines. So
it's overwhelming, even for me.
All right. Well, it is 12:58, Dr. Jetelina. I can't thank you enough for joining us here today for an hour. Again, thank you, Dr. Jetelina, for your time today. Really fascinating to hear all about your page, how it got started, and your reach. It's really fascinating. We're going to continue to follow you because we love your page. So
thanks for having me. Appreciate it.
Absolutely. Thank you.